Good morning, I'm Rosalie. Life is ever changing. Our health is the most valuable asset we need to protect. And taking our life lessons to the public through advocacy can save lives. Medicine and technology is essential to healing the chronically ill. So take time this summer to enjoy your life. Plan a little getaway to boost your mood, relieve stress, and increase your quality of sleep. All this when we return. Travel is hot in summer of 2023, so take on a healthy attitude and change your environment. A AAA survey found 52% of U.S. adults are just as likely or more likely to consider taking a cruise vacation than they were before the pandemic. Joining us with travel tips, top destinations, and how Norwegian Cruise Lines is helping travelers sail away is cruise and travel expert and editor-in-chief of Cruise Critic, Colleen McDaniel. Good morning, Colleen.
Good morning. Thanks so much for having me today.
Colleen, you have a true passion for traveling by water throughout the world, and you share your firsthand experiences and cruise reviews with Cruise Critic readers, as well as media outlets. So what should people be thinking about before planning their next cruise vacation?
Well, first of all, people should know that cruising is a really great value. And we're actually seeing that value gap grow when compared with land vacations, which, let's be honest, are just getting a little bit more expensive all the time. Cruising includes your meals, your accommodations, your entertainment, and your transportation. So it takes you from port to port, place to place. You wake up somewhere new every day, and yet your home base is this gorgeous ship, and you get to be there night after night. And cruising can really take you almost anywhere in the world. We're hearing from our readers that they have a growing desire to hit those bucket list destinations. So if you're considering cruising overseas, consider Norwegian Prima. The ship debuted last year, and Cruise Critics editors named it the best new cruise ship of 2022, in part because it has terrific entertainment, amazing dining, and a world-class spa. And, well, can't we all use a little bit of that self-care right now?
What travel tips do you have to decrease the stress of travel planning?
Well, my number one tip is always do your research. So visit sites like cruisecritic.com, where you can read reviews from real cruisers, and you can get expert tips and hacks for your traveling to really help you feel like you're securing that great cruise. We also recommend that you actually don't start with price, that you really find the cruise line or cruise ship that matches your personality and interests. And once you find that, that'll help you pick your destination. So head on over to the cruise line website and familiarize yourself with the destinations and itineraries. For example, Norwegian sails to nearly 400 destinations worldwide, and you can visit the site and check out the itineraries to really help you plan that dream trip.
What cruise destinations offer themes like Lover's Getaway, geared for more adult itineraries at port destinations?
Alaska could be all about romance. What I love about Alaska is you can do a little bit of a taster cruise, a little shorter one, or you can really go out and do a longer cruise that gets you both land and sea. Norwegian, for example, is offering what they call a cruise tour, which gets you land and sea, and it's 14 nights. Now, if you want something a little bit more exotic, you can head overseas. And a lot of people love the Mediterranean for many terrific reasons. But what's really having its day right now is Northern Europe. And when I'm talking Northern Europe, I'm talking about Greenland, Iceland, the British Isles, and even France.
Share some important factors for travelers to consider when booking a Norwegian cruise vacation so they can avoid connection travel adversities.
So a couple of tips we always give to people, though, is one, arrive at least 1, maybe even 2 days ahead of your vacation, which is great for a place like Miami, because who doesn't want to spend a couple extra days at the beginning of their cruise in Miami? But that ensures that you will make it to your ship on time, even if there are unforeseen delays that you cannot do anything about. Additionally, we also tell people that they should consider travel insurance. This is a worst case scenario, but you want to make sure you're covered in case something goes wrong.
Where can we learn more about Norwegian's summer cruises?
For more information on Norwegian's new ships and itineraries, they can visit ncl.com. And for great cruise reviews and expert advice, please visit cruisecritic.com.
Thank you, Colleen, for sharing a variety of experiences to explore our dream cruise vacation.
Thanks so much for having me today.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
According to the National Institute on Health, the demand for house calls is increasing with the aging U.S. population and increase in homebound patients. The public and healthcare industry acknowledges the value of house calls to improve patient outcomes for older adults and vulnerable populations. Common house calls manage acute or chronic illnesses, coordination of a post-hospitalization transition, and health assessments and end-of-life care. Home health care providers use a checklist to monitor a patient's impairments, immobility, nutrition, home environment, medications, examinations, safety, spiritual, health, and services. This checklist provides a comprehensive health assessment. Careful planning for scheduling of a house call can be efficiently integrated into family medicine practices, including direct primary care practices. Joining us this morning is Lakita Hollingsworth, RMA and Patient Care Coordinator, Patient Liaison for Infinity Healthcare Group Home-Based Primary Care Program, with 20 years of experience in the medical industry. She joins us this morning to discuss home-based primary care house calls as the latest new service to improve outcomes, reduce costs, and provide patients stress-free care visits in the comfort of their home. Good morning, Lakita.
Good morning.
Infinity Healthcare Group of South Florida developed a unique new service to meet the needs of a variety of patients to address and improve the quality of healthcare for patients with chronic conditions.
Yes, here at Infinity Healthcare, we're always trying to come up with inventive ways to help improve our patient care. And one thing that we realize that many patients living with complex medical issues, accessing medical care in a traditional office setting is not always easy or safe for them. This is why we have designed a program that will bring these comprehensive services directly to our patients' home.
Lakita, you referred to providing services for your patients with chronic conditions by offering a safe and secure environment to continue and maintain quality care by their provider.
Yes, that's correct. Our goal is to reduce the amount of hospital admissions and ER visits and provide optimal care to our patients, keeping them happy, healthy, and safe. And we can accomplish this by making primary care easily accessible to all our patients. So we can offer at home lab draws, electrocardiograms. We're going to do their vitals, monitor their blood pressure, their pulse, track their weight. And also we can complete their hospital follow-ups, make sick appointments, all in the comfort of their home. And then at that time, our professional staff can answer any and address any medical concerns that they might have.
According to the United States Census, by 2034, there will be 77 million people 65 years and older, compared to 76.5 million under the age of 18. Though millions of people 65 and over are very active and healthy. So what specific aging patients is this program designed for?
We designed this program for patients that are suffering from multiple chronic conditions such as diabetes, heart condition, walking and mobility problems, and much more. And these patients, because of these conditions, are unable to travel to the doctor's office. Also, we can complete their hospital follow-ups. So if they get admitted to the hospital and they're unable to come to the doctor's office, we can see them at their home to make sure that they're on their road to recovery. And another thing is that we can complete some sick appointments. So certain patients, their only means of resources is to call 911 and get admitted to the emergency room, even for the minor of issues. So we want to try to bridge that gap and keep them out of the hospital, because the danger of that is they leave themselves exposed to other ailments, viruses, or infections that are just associated with being overpopulated in the hospital.
Lakita, share with us your personal experience when you go into a patient's home with a chronic illness.
You know, I had a really great experience recently with a patient that was like in and out of the hospital. She hasn't been able to see a primary care physician in about 2 years. The only resource she had was to call 911 and get services through the ER. So when I came to explain the services that we offer, she was literally in tears because she knew that she no longer had to wait, until things got worse, things got bad to end up going to the hospital. She knew she had a service that can be provided for her in her home. So that's when I really realized that this service is very much needed for patients. And I'm sure a lot of patients are suffering like she was and that need this type of care.
When a patient is discharged from the hospital after an illness or surgery, is there a time period that they should be seen by their primary care provider?
Yes, they need to be seen within 14 days. And the reason for that is that we need to try to ensure that they're following all the discharge instructions and that they're on their road to recovery. So there is some recommendation and requirements for that.
Lakita, as a healthcare assistant, would you consider this modern day home healthcare program a pioneer healthcare service in primary healthcare?
As you alluded to earlier, the population is definitely living longer thanks to modern medicine. And as we age, different things can arise in our medical health. And we already seen a major increase in non-medical vans. They're everywhere to get patients from their home to the doctor's office. However, there's a definite need for patients that can't get into the vans and can't sit in the waiting rooms. So we're going to see more and more of this type of services pop up because it's a big need for it. And it's so thrilling to be a part of an office that is trying to expedite this.
All right, how many people in our nation are not receiving any type of primary health care services?
I read an article in healthaffairs.org, and it states that approximately 4 million adults that are homebound are having difficulties in reaching primary care. So it's quite a few.
Where can our viewers learn more about home health visits as patients of Infinity Healthcare Group?
So you can call our office to be evaluated for this service. You can call 954-586-8058. And again, that is to get established with the practice and get evaluated for the possibility of this service if needed.
Thank you, Lakita, for sharing the new Infinity Healthcare Group home healthcare service to address the needs of homebound patients.
You're welcome.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Helping Floridians maintain health care coverage is the foundation for a greater quality of life. But life constantly changes. And for millions of Americans, that means you may need to change your health care plans that may not have you eligible for under your current coverage, or otherwise have access to your current health care plan. Now, what do these changes mean? Well, they're often referred to as qualifying life events. And that means individuals who are impacted need to find other affordable coverage options that meet their needs. Joining us this morning to discuss the importance of maintaining health insurance coverage, whether through Medicaid or other health care plans, is Marcus Robinson, President of Individual and Family Plans at United Healthcare. Good morning, Marcus.
Morning, Rosalie. Happy to be here.
And thank you for joining us again. Marcus, explain what are qualifying life events and how can they impact an individual's health insurance coverage?
Absolutely. A qualifying life event is a life change that can make people eligible to enroll in health insurance outside of the yearly open enrollment period. Some examples of a qualifying life event is a loss of insurance coverage, whether that be through your employer-based coverage, a government-sponsored plan, or an individual plan design. If you lose your coverage, that is a qualifying life event. Additionally, change in marital status, whether you are newly married or divorced, if you are adding a child to your family through adoption or through birth, or if you're relocating or changing your address or zip code out of the state. Lastly, changes in income can also be a qualifying life event.
All right, so a qualifying life event does not mean a person had a terrible car accident or a life-threatening illness, right?
That's correct. So a qualifying life event is one of the life changes that I mentioned. And of course, during the open enrollment period, you can come in for any reason and enroll, but outside of the enrollment period, you need a qualifying life event the majority of the time to access and gain coverage.
So now we know what a qualifying life event examples are. And that would be like a loss of job, marriage, divorce, or having a baby, or adopting a baby, and of course, changing your zip code. So how does a qualifying life event affect a person's health care coverage, and what options do they have?
Absolutely. So if you have a qualifying life event, that allows you to shop and enroll in a plan design, again, outside of open enrollment period. But what I like to address is, why is it so important to keep coverage? The phrase that I like to commonly use is continuity of coverage. If you think about how important that relationship is with your physician or your doctor, that's foundational to your well-being and the care that you receive. So you want to maintain coverage to keep that relationship with your physician. Additionally, it keeps you having good access to the overall healthcare system, having access for your children and your family. Preventative wellness checkups are really key to your overall health and well-being, and access to care and, of course, the delivery system can help you early detect newly emerging conditions before they become more serious. And lastly, maintaining quality health insurance coverage is going to give you financial stability as well to avoid those unforeseen kind of acute healthcare needs as well.
Marcus, what are some options of coverage a person would be eligible for after a qualifying life event?
Yes, the rules change depending on which coverage you seek, but as a rule of thumb, it's typically 30 days for a qualifying life event once you have one that you can enroll. There's other qualifying life event circumstances that may be a little longer than that, but rule of thumb, it's around 30 days to enroll post your qualifying life event. Yeah, a lot of people have questions. What is the right plan design, the right option, the right coverage for me? Two places that I'll suggest people go and look to find more information. First is healthcare.gov or the marketplace. You can, of course, shop and compare all of your options in the Affordable Care marketplace. And United Healthcare, we offer a free service as well to help people navigate all of the different insurance options and what's going to work best for your financial situation as well. You can go to uhc.com/stay covered to get more information, and we'd love to help navigate you and provide you the best option for you and your family.
And for those who would like to speak to a live agent, who can they call?
It's a URL, uhc.com/stay covered. There are also licensed insurance agents that you can look for, or healthcare.com, healthcare.gov. There are navigators as well that you can talk to live.
Thank you, Marcus, for joining us and offering options for those Floridians who have a qualifying life event to ensure that they can maintain good health care coverage.
Thank you, Rosalie.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
The Center for Disease Control reports that 30% of new cancer cases in women is breast cancer. According to the National Institute of Health, African American and Black women have more aggressive breast cancer subtypes and are diagnosed at younger ages with an increasing incidence rate. These disparities have resulted in Black women continuing to experience the highest mortality rate from breast cancer of any U.S. racial or ethnic group. However, national screening mammography guidelines do not reflect the high-risk status of Black women to improve access to early screening. Georgia Bulldog Keely Ringo is the two-time champion and 2023 Philadelphia Eagles draft pick. He started his breast cancer advocacy after watching his mother Truly fight breast cancer. He took his battle on the football field to the battle against breast cancer. Keely and Truly join us along with OBGYN Dr. DeCarla Albright to introduce the Truly and Keely Ringo Family Foundation, committed to eradicating triple-negative breast cancer. Good morning to all of you.
Thank you.
Thank you for having us.
Keely, congratulations on being drafted to the Philadelphia Eagles. Now, your journey as an NFL football player is very unique. Tell us how you began your advocacy role for women's health.
I become an advocate for women's health, honestly, wanting to support those with families that are similar to me and my mother's. Of course, just people that have been in our situation. Definitely wanted to use this platform just to be able to spread the awareness of early detection.
Taking your voice as an advocate took on a greater meaning when you and your mother started a nonprofit organization. Tell our viewers about the Truly and Keely Ringo Family Foundation.
Yes, ma'am, the Ringo Family Foundation, as well as specifically the voice of just trying to help families seek early detection of breast cancer overall and receiving their mammograms early.
Truly, you were the motivation behind this foundation. Back in 2020, Keely was a freshman at the University of Georgia, and you were diagnosed with triple-negative breast cancer. Share with us your advocacy mission.
The Ringo Family Foundation strives to eradicate triple-negative breast cancer, the #1 most aggressive type of breast cancer that actually disproportionately affects women of color.
Truly, we are so happy to hear you're now in good health after your battle against breast cancer. So share with women, young and older, the importance of annual health and wellness exams that include a mammogram.
To please don't procrastinate. Your health is number one. I stand corrected by having put off a mass that was palpable for 9 months prior to going and having it checked. When I did actually schedule my mammogram, I communicated to them that I had a palpable mass, so they incorporated a biopsy into my initial assessment, which revealed 9 days after my son left to college that I was positive for triple-negative breast cancer.
Dr. Albright, Truly was only 39 years old when she was diagnosed, and there was no family history of breast cancer. Why is breast cancer screening crucial to saving women's lives?
It's important, definitely if you're age 40 and over, to make sure that you have your screening done, get your mammogram. I personally recommend annual mammography, but talk to your doctor and have the conversation about what's best for you. Also, know your family history and be aware of your breast health. Traley's story is really critically important, that if you feel something, make sure you let your doctor know. It's easy for us to not prioritize ourselves and get caught up with our family and work and jobs, but it's so important that we take charge of our health and make sure you're being seen if you have a concern.
You know, Dr. Albright, in the last couple of years, many women during the pandemic missed their annual health exams. So what advice can you offer them today?
Get your mammogram as soon as possible. There's no need for further delay. Radiology centers are open. I would also recommend that they ask for a 3D mammogram, because that will be the best screening technology that's out there right now to detect breast cancer. And we want to detect breast cancer earlier. So earlier detection does, in fact, save lives. So no need for further delay. Speak to your doctor, get that order, and go ahead and get that mammogram done.
Now that's excellent advice. Keely, where can our viewers find more information on where to get a 3D mammography?
For more information, you can go to genius3dnearme.com.
Thank all of you for joining us this morning to advocate for the importance of annual breast cancer screening.
Thank you.
Life is ever-changing for us, our families, and our community. Taking our life lessons to advocate for change in our healthcare system is one of the most essential voices in humanity. Successful healthcare outcomes begins with monitoring the chronically ill. Our health is the most important asset we own. So share your life lessons to increase a greater quality of life in your community at facebook.com/Rose Lee Show, and follow us on Instagram at The Rose Lee Show. Watch this episode and many others 24/7 at RoseleeArcherShow.com. Thank you so much for joining us this morning, and we look forward to seeing you soon.